Hey, it's Jessica DeMassa with WTF Health. What's the Future Health? You're joining us for a special series that we're doing on COVID-19 and health tech. And to weigh in on what's happening with virtual care and telehealth, we have none other than Joe DeVivo. He is the CEO of Intouch Health. Joe, it's a pleasure to have you with us today.
Thank you, Jessica. I appreciate being with you.
So we are, obviously watching all of this unfold, and you are very much on the front lines here trying to deploy different telehealth solutions so that hospitals can take care of their patients. So give us a sense of what you're seeing from your perspective as you're working with these health systems.
It's hard, Jessica. It's really hard. In some instances, we have customers who've been very progressive. They've had their systems out there in many different emergency rooms already, providing different types of critical care. We are in intensive care units throughout the country with installations, and most of those installations have been repurposed to deal with this crisis. We've all seen a significant shift in the type of care, elective procedures being pulled back, and then many of the urgent, especially COVID cases, taking precedent. We're seeing a mass repurposing of their architecture in order to meet this need. And then there are some other health systems who probably haven't been as progressive with this and haven't taken it as seriously, and they're scrambling. And some of them are, in the tough areas, and we're doing everything we can to scramble with them. This is a real crisis, and some of the best people you'd ever know who are on the front lines and who are taking care of patients every day are really concerned. And the administrators who are responsible for them are scrambling in any way possible to support them, to give them several degrees of separation to be able to still provide the right patient care, but protect their caregivers. So it is really challenging, to be quite honest with you, on many different levels.
Well, tell me, I guess, a little bit about when you're working with these hospital administrators, and we're talking specifically about, you guys have always been on the enterprise side of the telehealth world. And so as you, like you said, they're retooling their architectures, and everybody is just basically scrambling. What is the demand for right now? Is this to help support frontline staff in the hospital to keep them distanced virtually from patients so that they're not so at risk when they walk into a room? Or, are you guys dealing at all with the direct-to-consumer side of it? Give me a sense of what you guys are working on specifically at InTouch.
Well, the answer to that is really yes. So the first step was to ensure that the local caregivers do have a degree of separation. So the first patient in the U.S. was up at Providence Healthcare. We've heard a lot about their experience, and Providence is a very close partner of Intouch Health. We have installations all throughout their system, and they've repurposed some of the installations specifically to create a room where the caregivers can be very responsive to the patient, but they don't have to enter the patient's space every time they need to communicate with the patient. And you sometimes you don't realize how difficult that is, and what it takes for a caregiver to enter in that infected space. And when they have to completely gown and double glove and get ready to go into that space to be able to communicate with the patient. And then when they come out of that space, they remove all that PPE, and we've heard a lot about PPE shortages. So every time a caregiver can engage with a patient who's in that care setting virtually, they save a full set of PPE. I actually heard for the first time a new term calling a PPE ROI, where they're looking at how much savings they're having so they can be responsive to the needs of the patient to the extent, or to check in on the patient without having to enter that zone of contamination. So you see, hospitals have a certain number of ICUs, whether they're 6, 12, some of the larger institutions 20, but they need hundreds of beds in order to deal with these patients. And so in order to minimize the contact, they're setting up virtual rooms where they have complete audiovisual and capabilities to have that dialogue. So it's first of all, it's saving them touches, it's saving them PPE, and then incredibly, there are caregivers who have gotten infected. And we have this tremendous shortage now of people who have to be quarantined in their home, and thank God so many of these caregivers are asymptomatic or are dealing with mild symptoms. And so under that 14-day quarantine, through the InTouch system, they're actually, even from quarantine at home, beaming into those sites and still caring for those patients. And so that's been, one of the major use cases in the very beginning, as we've now almost completely run out of hardware. We've been sending it to all different types of locations, some on donation, some brand new, and now we're deploying software to enable as many different clinical sites as possible to help the caregivers be as efficient as possible.
I mean, say more about this, because I mean, you alluded to it earlier. Initially, it's like there was this mad scramble among health systems to re-architect what they had in place, and part of that may or may not have been whatever telehealth system that they were operating on. I mean, we've known for a long time within the industry, certain hospital systems have had more robust telehealth deployments than others. So how are you guys helping solve that? I know you just mentioned the software rollout, and I think that's something that I've read that you guys can turn around in as little as 24 hours. But tell me more about that.
So first of all, what a lot of people don't understand, especially about the hospital environment, is the hospital environment is secure. You have firewalls and different types of security provisioning. You have patient data that they're trying to protect. And so these are not environments that are easy to use basic consumer audiovisual technologies. We've seen a mass explosion. I mean, every hour I'm on a different platform based upon who I'm speaking to as I'm working now from home. But those platforms aren't provisioned to be able to go into multiple different environments that are all highly secure. So we're really threading the needle. And what InTouch did to build its architecture to allow, for example, one doctor with one click to go to 30 different sites they're credentialed in on one application instead of having to worry about all those different environments. We have this incredibly powerful software capability. So we can now deploy our software on a tablet, on a phone, on a PC, any device with a camera, and they can put it in the room to be with that patient. So if they don't have the ability to buy a purpose-built device, they have the ability to deploy software and build up telehealth right away and use a lot of the architecture we have in the background. Second of all, we've created a COVID-19 instance of 4 different workflows that allow doctors to now start talking to patients in their home using browsers to be able to document, to schedule, create those virtual engagements, and for that matter, get into those care environments. So InTouch has historically been a robot company. Everyone's known us to be a stroke robot company. But in this crisis of mass escalation and mass deployment, it's been our software that's really helped us scale.
I want to ask you about the relationship with Teladoc. So, at the beginning of this year, massive acquisition deal announced of your company, $600 million. And that was the last time I spoke with you, which seems like it was an eternity ago, back in January at JP Morgan Healthcare. So how are you working with Teladoc through this? If you can talk about that a little bit.
Well, it's been pretty amazing. First of all, it's a first-class team. We are very proud at InTouch of our culture of patient first, of quality, and also execution, of doing, saying what we do what we say, and living up to our commitments. And that we've found that the culture fit with Teladoc is exactly along those same principles. And that's actually made it much less of a chore and much more of a, hey, let's go do something together and let's go solve some problems. And so we've signed an agreement between our 2 organizations to be able to co-sell, where we would reward each other's organization for the success of a sale of each other's product. And that has enabled us to hit the market fast. And so we've done many joint sales calls. We've been able to work together to come up with guiding principles of what our integration would look like for customers. And we've hit the ground running. We've already seen some success in that. I'll let Teladoc talk about that. I'm probably not the one who should talk about that. We'll let Jason do that later. But we've been very active. We've not been sitting back and waiting. And at the same time, we've had a very mindful integration process. So when the deal does close, we'll absolutely be hitting the ground running.
No, and I know the deal is set to close at the end of Q2, and that's always been the case. Yes. But I remember clearly the vision that was articulated when I spoke to you in January was this whole idea of taking virtual care from the hospital to the home and back again. And so that whole end-to-end delivery model for virtual care. It's just, I'm curious about how that's unfolding now, in particular, among this pandemic. And so, reaching out into not only helping, from your side of things on the enterprise side, helping stand things up, but what are you seeing in terms of, helping support the physicians who are trying to, reach out of the hospital walls into the community and take care of those patients who they've told, you're non-COVID, and we know you need care, but stay there and we will deliver care virtually. What are you seeing there?
Well, we talked about it at JP Morgan when we met just a few months ago, and this is what's the future, and you definitely hit on the future before. And actually, I don't think we both realized that the future was happening, very, very quickly. But what is happening today is patients don't want to go into waiting rooms. They don't want to go into the emergency room. They don't want to go see their doctor for the elective ailments that they have today. And doctors' practices are being shut down. They literally are being frozen. So from an evolution standpoint, with telehealth being reimbursed, so now you have a temporary, under this COVID bill, the ability to charge for a virtual visit. So now we're seeing, thousands and thousands of doctor practices build a virtual care arm, physical therapists, behavioral health therapists, orthopedists, cardiologists are all now managing their patients through this crisis through telehealth, and they're being paid. So we're seeing this massive acceleration, because if the only way that the clinician would be paid in the past is if they had a face-to-face visit. So taking down the economic barriers, taking down some of the state licensure barriers have really opened up, and the genie is now out of the bottle on telehealth. Many people really kind of question, can I do this? Is it functional? Do the patients really respond to it? And we're learning very quickly by necessity that absolutely do patients not only respond to it, they're actually going to demand it in the future. We've seen that demand on the Teladoc side, where patients are reaching at an incredibly increasing rate to have a physician interaction. And now with reimbursement, we're seeing the core part of healthcare react. Historically, I look at virtual care as a bell curve. On one side of that small tail of the bell curve, are the virtual care companies, the Teladocs, or that dominate that space for D2C. And it's still a small subset of the number of procedures. There's millions of consultations a year, and we're seeing a subset of that. On the opposite side of the bell curve is high acuity, and what InTouch has been doing for critical care. This crisis and the changes in reimbursement have opened up the middle of that bell curve. The core everyday transaction of healthcare is now being impacted by virtual care. And the big question that everyone has is this going to stick? Is this going to continue? Is this a crisis management tool and we're going to go back to the ways of the past? Or is that genie out of the bottle?
Joe, what do you think? You've been in the industry a long time. Answer that question for us. What are your thoughts on it? You walked right into my next question. What do you think? Are these going to stick or not?
Well, it really depends on government policy, and the government's been very concerned about opening this up because of overutilization and potential abuse of the ease of access. I hope that during this time, that the data shows that this was probably the most productive use of clinical time, the safest way, and then to take numbers, very high percentages of transactions that can come out of the physical health system to become more efficient. So, it really, at the end of the day, I believe there's going to be substantial demand at the hospital side. Patients are going to demand it. Every health system I talk to is planning for the eventuality that this is permanent. But at the end of the day, those who can control the purse strings, those who control payment, and whether they continue to pay for this is going to determine whether or not we have permanent access to the middle of that bell curve. So truthfully, I'm hopeful. I believe hospitals are going to ask for it. I think physicians are going to demand it, and patients are going to demand it as well. And we hope the regulators get great data to show that this was much more a part of the solution than a way of over-consuming healthcare.
I mean, and we know that, in hospitals, a lot of them, margins have been slim for a long time, and, proving out this virtual care use case at scale, even though this is not the way we wanted to prove it out, The fact is that we're here. Do you think that, I mean, I heard this great little soundbite. It's the commissioner from FCC who's got that stimulus money earmarked to help hospital systems set up their telehealth platforms. And he was saying, this is like the healthcare equivalent of moving from a Blockbuster video store model to a Netflix model. And I'm curious on your side, I mean, you've worked with hospitals for years and you've talked to all of these administrators on the enterprise side. Do you think that they're going to be able to, or they're going to see enough potential in virtual care at scale as a result of this to pivot their business models to really recognize telehealth as a potential revenue stream?
Personally, I do. I do very much. We've seen, the Blockbuster to Netflix is a great analog, and there's actually many analogs, that come into play. And we've seen online banking and what happened in the banking industry, where we didn't see services go away because of online. We saw high volume, low value services go virtual, like paying your bills and checking your balances and doing deposits. And you don't need to go into a physical infrastructure in order to do that. Or whether we're booking flights with airlines, we're not having to call a travel agent or go into the airport and then and get your seats. You can do so much of that on your own. It takes a lot of cost out of the system, and it makes things more efficient. Wherever you have a lot of labor, you have inefficiency, and healthcare is one of the markets where it has one of the highest percentage of labor as the overall cost. So I don't think there's a doubt that virtual care will be here permanently. I personally think it's the regulators and the payers who are going to decide how quickly it stays. But right now, everyone's experiencing it. Patients are realizing, and it's amazing because even looking at Teladoc, there's so many employers who offer this as a benefit, who people have this. If you're out there and you don't know about virtual care, most likely your employer has a benefit through your insurance company that actually provides virtual care. And the utilization rates historically are low, but they're growing at a nice rate off a small number. But what this is now doing is building the awareness for everyone that this actually exists, A, and B, it's highly productive and highly accessible, and allows for me to not get into a complex environment, but also, drag my kids into a waiting room and have to take a day off of work or pull them out of school. The efficiency of this is going to be so well understood, and millions of Americans have access to this benefit who don't use it. So I think we're going to see significantly high utilization rates of those benefit plans. And then a lot of it will again depend on payers as to whether or not they make this permanent at the Medicaid level, at the Medicare level, and then all the other private payers.
Has there been anything that surprised you in all of this, Joe? I mean, they say like necessity is the mother of invention. I mean, you've got your robots in different hospital systems all across the country. You've got people using telehealth for different things just because they've never been in a situation like this before. Has anything, surprised you in the way that your platform and your machines have been used during all of this crisis?
Yeah. What's been very surprising is to see how many different virtual platforms are running at the same time, and to see literally as our society is going virtual, we're almost breaking the internet, and we're seeing so much utilization and so much consumption. I've heard through articles that some of the large companies are actually reducing their reducing their streaming density in order to deal with this type of capacity. And I think everyone's creating this new normal on how do I go from this platform to this platform and this platform. To do it inside the health system environment, to keep the patient record, to be able to bill for it, to be able to be secure. This is very, very hard. And I think what people are going to learn is that there's a need for industrial systems to have the capability of working in these regulated environments. But the other thing that I've learned is how amazingly scalable the platform is, and how quickly we can get on. We would put maybe 500 to 600 doctors a quarter on our platform, and maybe create 200 to 500 new locations. We are in the thousands and tens of thousands now, and to see how quickly people are scaling, and then once they get it going, and then how easy it actually is to use. So I never anticipated, and no one did, the level of uptake and the level of scale. And I'm just very pleased that as InTouch, we pivoted to a networking and software platform, because if we were hardware only, we basically could, so much of our hardware was pulled through the system over the last month. And now we're able to use the power of our software and our power of our networking to connect, so many different people and so many different locations very quickly. So seeing that adoption has been heartening, because we know we're helping people. We've received emails from health systems who appreciate the response that the employees at InTouch and TellaDoc have given them. They know that at every moment's notice, that the ability of a physician to consult with that patient can improve the outcome for that patient, and to hear their gratitude, to know that we care as much supporting them as their patients. It's on a daily basis, you deal with the stress and of feeling what they're feeling and want to move quickly, and our team has been working around the clock to make that happen. So seeing the scalability, seeing the applicability, and also seeing the InTouch employees in action and caring as much as and being so selfless has been truly unbelievable.
That's amazing. And what I actually kind of find so endearing about what you just said is that you genuinely, like, in some regards, seem surprised at the uptake of virtual care. I mean, you're somebody who's been around for a long time, and the fact that you just are kind of bowled over by how quickly people have embraced it, how much it's being used, and then to watch your company kind of rise to the occasion. It's really endearing.
Yeah,
that you seem so surprised.
I know. Well, it's kind of funny too, because I've been giving talks, about the applicability of telehealth and what can happen in the future. And sometimes it's amazing. I've been in the medical industry for almost 30 years. I have friends who are all throughout the industry. And when I came to InTouch, and I tried to explain to them what I did, and virtual care, and they're like, what do you do? Well, they're like, oh, okay, well, good luck with that, Joe. That's really, I'm happy if you're happy. And up until literally a couple of months ago, it's still hard to explain to the average person what we did and what the value was. And now it's the most obvious thing to everybody. They see it, they understand it, they use it, they consume it. And the awareness has been extraordinary. I've never experienced anything like going from a niche obscurity to being one of the solutions and ways to help accelerate the access and the ability to provide care.
All right, last thoughts from you. Give us some advice on that. So the spotlight is shining brightly on telehealth and virtual care right now. How do we make sure, as this sector of the health tech industry, not to miss this opportunity to really shine? What's your advice?
Well, first of all, we need the government regulators to make all the changes that were made in order to make it easier for statewide credentialing for virtual care, or nationwide credentialing for virtual care across statewide. And second of all, to have payment be permanent. That has to be permanent. We have to lobby our government officials, and we have to make all of this permanent, because we're seeing today that utilization, and we're seeing the utility. There is a scarcity of clinical care. Physicians do not live where all patients reside, and especially when there's a shortage of an infectious disease doctor, or a hospitalist, an intensivist, a neurologist, a behavioral health specialist. We can fractionalize them, and we can bring them anywhere in the world. We're helping patients through the platform in Italy. We're helping patients through the platform in the UK. We're helping patients in all different markets around the world where there's hotspots and zones, because we, InTouch has built a global secure private cloud, and we've been able to enable a physician not just go 10 miles away or 100 miles away, but thousands and thousands of miles away. And what's so important, especially for my colleagues to know, is that this technology can be used for their businesses. My first job in medical was a sales rep. I'd get up 7 o'clock every morning, and I'd be in the operating room working with a doctor prior to a surgical procedure, making sure that they understood how to use an instrument when they were going in, and to be there as a support. Today, if I was a sales rep, I couldn't go into that operating room.
Right.
I'm not allowed in, because hospitals are saying no reps allowed, and this happened at the very beginning of the crisis. So how do you be there for those caregivers? Well, this technology that we have at InTouch is also very applicable B2B. We can help orthopedic companies have their reps not physically be in the room, of which I ran an orthopedic company at one point in time, but allow that rep to be there virtually to provide clinical technical expertise on instrumentation to help the room being set up. We can help all different types of device companies by putting a device or software on a device in the operating theater, scheduling reps or technical specialists to come in and out. The repless OR is here today. And if you're in the B2B environment and your reps are all stagnant, there's ways to help them out now. I
love that. The repless OR, you heard it here first. I love that. Well, Joe, thank you so much for taking the time to join us. I know that you are incredibly busy, and we really appreciate all of the work that you and your team at Intouch Health are doing over there. Thank you so much for taking the time and letting us, hear your thoughts on where virtual care is headed, not only during this pandemic, but actually, through it. So we appreciate your perspective.
And thank you for the platform. Appreciate it.
Oh my gosh, yeah, absolutely. I'm Jessica DeMassa with WTF Health. If you want to check out more of these interviews that I've got with different health tech leaders across virtual care, remote monitoring, digital health, you name it, I've got them up on my YouTube channel. It's youtube.com/WTF Health. Thanks again for joining us. Joe, thank you again. Take care.